All right, so our group is presenting on HIV. It's Jafet, Lauren, and Brooklyn.
All right, this is Brooklyn. I'll start by talking about the pathology of HIV to understand how this virus operates within the human body and compromises our immune system. So first, HIV primarily targets the CD4 T cells, which are a type of white blood cell crucial for coordinating the immune response. As the number of CD4 T cells declines, the body becomes increasingly vulnerable to infections and diseases that a healthy immune system would typically be able to fight off. Second, HIV binds to the CD4 receptors. Following this binding, the virus fuses with the cell membrane and releases its RNA into the cell. Then this newly formed viral DNA is then transported into the nucleus at the host cell, and this integration allows for the virus to remain in the host cell. Once integrated, the viral DNA hijacks the host cell to replicate and reproduce within the human body. So here I'll talk about the stages of HIV. First, we have the acute stage, which occurs 2 to 4 weeks after the virus enters the body. During this period, individuals may experience flu-like symptoms such as fever, sore throat, swollen lymph nodes, rash, muscle aches. Following the acute phase, HIV enters the chronic stage, also known as the clinical latency stage. During this stage, the virus continues to replicate at low levels, but it may not cause any symptoms. And the final and most severe stage of HIV is acquired immunodeficiency syndrome, which is AIDS. AIDS is diagnosed when the CD4 T cells drop below 200, or when an individual develops certain opportunistic infections or cancers that are rare in the people with healthy immune systems. So at this stage, the immune system is severely damaged and the body is unable to fight off infections and diseases effectively. So why is HIV a problem? HIV is a global health problem due to its high prevalence, significant mortality and morbidity rates, and the severe stigma and discrimination faced by those infected. The economic burden on healthcare systems is substantial, affecting both developed and developing countries. So here I've added an image from the World Health Organization where they've broken down the number of people living with HIV currently. This is from 2023, and that is 39 million. And here I talk about the transmission of HIV. So it's primarily transmitted through the exchange of certain bodily fluids from an infected person to an uninfected person. These fluids include blood, breast milk, semen, and vaginal secretions. So for transmission to occur, these fluids must come into contact with the mucous membrane, damaged tissue, or be directly injected into the bloodstream. So it's important to note that HIV cannot be transmitted through ordinary day-to-day contacts such as kissing, hugging, or shaking hands. And certain behaviors that increase the risk of getting HIV include engaging in unprotected sex, whether anal or vaginal, using needles or syringes that have been used by someone else. Healthcare workers and others who handle needles are also at risk if they experience accidental needle sticks, and in settings where medical equipment is not properly sterilized or where blood is not adequately screened for HIV. There is a risk for transmission through these medical procedures.
Okay, so this is Lauren. I'm going to talk about the scope and the epidemiology of HIV. So HIV remains a major global public health issue. It has claimed over 40 million lives. Ongoing transmission in all countries globally with increasing trends. So we're seeing that it just still has a really high prevalence and incidence rate. According to the World Health Organization, 39 million people are living with HIV at the end of 2022, and 2/3 of these people are located in the World Health Organization African region, which is important to note because in that region, they might not have access to as many resources or as much education about HIV. Currently, there is no cure. However, public health is focusing on prevention, diagnosis, and then treatment of the symptoms of HIV. The goal is to make sure that we are slowing the progression of this disease. Modern medicine has enabled people living with HIV to lead long and healthy lives. Some of the populations at risk include dealing with sexuality, race and ethnicity, and then behaviors. So according to the CDC, of the 30,635 new HIV diagnoses in the United States in 2020, 68% were among gay and bisexual men. As Brooklyn touched on, sexual practices has a lot to do with this. Race and ethnicity, Blacks and African Americans, and then Hispanics and Latinos are disproportionately affected by HIV compared to other racial and ethnic groups. And then behaviors, as Brooklyn touched on before, anal sex, unprotected sex, drug abuse, meaning injection with needles, and then she also touched on healthcare professionals, accidental needle sticks. All of these are risks for contracting HIV. And then here's a great graphic of HIV infections in the United States by race and ethnicity. This is from 2022 from the CDC, showing how Black and African American and then Hispanic and Latino cultures are disproportionately affected by HIV. So the impact on society, there's different categories that HIV is impacting. So that would be health, families, communities, and then economic growth. For health, this is causing an increased demand for medical care, and then managing a lifelong chronic disease has an impact on society as a whole and individuals. Families, this is causing families to experience poverty, social stigmas, lack of support, and then face difficult questions. Communities, this can disrupt the life of an entire community. It can lead to uncertainty, fear, or even blame. And then economic growth on a societal level and even on a national level. This can impact the development of economic growth of nations, specifically developing nations with poor healthcare infrastructure, and it can even lead to food insecurity because so many finances are going into this long-term disease with no cure.
Okay, this is Jafet, and I will be going over the roles and responsibilities at the different levels. So federally, when it comes to the roles and responsibilities, they look into monitoring the prevalence of HIV, further researching HIV and funding programs. When they monitor for HIV, they look to see the prevalence of HIV throughout the US, the incidence rates, and the trends. It is important for monitoring to be done as it helps guide research and see where funding is needed in the country. For HIV research, it looks into further preventing HIV in high-risk groups, treatment for those that are HIV positive, as well as working towards a cure for HIV. Based off of the monitoring finding, grants will be given to those cities or states that have a high prevalence of HIV. These programs will help do testing, provide education, and give access to HIV medications. When it comes to the roles and responsibilities at the state level, they look into funding HIV prevention programs. These prevention programs can have different goals or different age or race populations that they focused on. However, the goal is all the same: to prevent HIV infections and to support those that are HIV positive. Testing is the number one way for individuals to know if they are HIV negative or positive. So it is important that these prevention programs are funded so that they can do outreach and test communities high at risk for acquiring HIV. Statewide, there are also partner services, which helps individuals that have been newly diagnosed with HIV to anonymously or with the help of a professional tell their partners that they have been exposed to HIV. This is an essential tool, as with the stigma and fear around HIV, it will help alert someone so that they can get tested and prevent the further spread of HIV. Locally, it is important for prevention programs to engage with communities that are at high risk of getting HIV. They can do this by going to common areas and provide education and testing. Support services is also a great resource for individuals that are interested in getting tested or in taking medication that helps prevent HIV but do not have the access to do so. Support services can provide transportation to appointments and assistance to apply to programs that provide free medication. It is also the responsibility of cities to report HIV cases to the state so that they can get more funding if needed to provide preventative services. Now, for resources available, there are Ryan White programs, which provide funding for medical care, medications, and support services for low-income HIV-positive individuals. This also helps ensure access to the medical care, mental health services, and support programs. There is also HIV testing. There is antibody tests, which is typically done through a blood draw, home testing kits, and rapid tests, which typically are done through saliva, and you can get your results within 20 minutes for rapid tests and then within a few days for a home testing kit. With Medicaid, it helps provide coverage for HIV-related care, medications, and support services. And throughout many different cities, there are also support groups which help offer peer support to those that are HIV positive and to those that are at high risk.
So we were asked to highlight 2 community health and public health interventions. So one would be STD testing centers. Many communities host free STD testing centers, and a lot of these have free HIV testing, which is a wonderful public health intervention that is helping a lot of people understand their status when it comes to STDs and HIV. And then, of course, advocacy and education. So this picture shows people marching to end the stigma for HIV, which is a very important role of our community and our public health nurses. Prevention levels, we have primary, secondary, and tertiary prevention. So primary prevention of HIV will be ensuring use of clean needles, STD testing prior to intercourse, reducing number of sexual partners, and then educating. Secondary prevention is early detection and diagnosis of those who are positive with HIV, and then medication and treatment compliance before the disease carries on its course. Tertiary prevention would be improving the quality of life of those affected by HIV, and then treatment and support groups. And then quickly we'll talk about the roles of the public health nurse. So education and prevention. A nurse can participate in community outreach. Public health nurses can conduct outreach programs to educate communities about HIV transmission, prevention methods, and the importance of testing. As nurses, we can host workshops and seminars, and then distribute resources, so distributing condoms, informational pamphlets, and other resources to promote safe sex practices. Another role of the nurse is screening and testing. So like we touched on before, HIV testing is crucial to understanding and stopping the spread of HIV, and then offering counseling or getting an interdisciplinary team involved when someone is diagnosed with HIV is a very important role of the nurse. Care and support, of course. Case management, nurses coordinate care for individuals living with HIV and can help them navigate the healthcare system and access all necessary services. As we've talked about before, HIV is a lifelong diagnosis until there is a cure in the future. So for now, they are going to need some case management interventions. Direct care, providing medical care, administering medications, and monitoring patients' health status is an important role of the nurse. And then, of course, facilitating support groups. Advocacy and policy development. So advocacy the same that we would do with any patient that we come across, advocate for our patients to receive the best form of treatment and care that they can. And then policy development. Public health nurses may be involved in developing and implementing public health policies related to HIV. And then we'll talk about research and collaboration. Research is super crucial for HIV because, like we've mentioned before, there is no cure. So ongoing research is going to be crucial to the future of our patients. This includes data collection, people who are currently diagnosed with HIV, if we can collect data to evaluate effectiveness of treatments and public health strategies, this will be helpful in the future. Interdisciplinary collaboration. So public health nurses are going to work with other healthcare providers, social workers, and community organizations to provide comprehensive care. And then partnerships, like we've talked about before. Local, state, and national organizations can enhance the reach and effectiveness of these HIV programs. And here are our references. Thank you.